My name is CGeffrard, and I'm presenting case study 2. So the behavioral targets for reduction are elopement, which is any attempt or occurrence of the client leaving a designated area and or adult for any distance without permission from an adult. Motor stereotypy, which is any occurrence of the client engaging in a restrictive and or repetitive motion, such as flapping hands back and forth or up and down and jumping up and down for at least 3 seconds. Non-compliance, any occurrence of the client failing to begin the task or demand within 10 seconds of the demand being placed and or continuing to engage in a task after the demand was placed to terminate the task. Screaming, which is any occurrence of the client making a high-pitched, non-functional vocalization with an open or closed mouth higher than a conversational level in the absence of words without permission from an adult. A new occurrence begins after every breath. Scripting is any occurrence of the client reciting a previously heard phrase or sentence at above talking level for any duration that is out of context with the current demand or activity. Property destruction, any attempt or occurrence of the client using an item or body part to make purposeful contact with another item or object, such as swiping materials off of table or away from him, kicking items, and or throwing an item into the air. The intervention description. So for all of the client's targeted behaviors for reduction, functional communication training was chosen as the intervention to address them. Functional communication training is an evidence-based intervention used in ABA therapy. It's also one of the most commonly used and effective interventions for severe behavior problems. It's a differential reinforcement procedure where the client is taught an alternative response that results in the same class of reinforcement that maintains the problem behavior. The problem behavior is placed on extinction, and it differs from other function-based differential reinforcement procedures in that the alternative response is a recognizable form of communication. So the intervention procedures are as follows. When the client engages in any of the targeted behaviors for reduction, he will be redirected to engage in functional communication training. The antecedent interventions that will be used are setting expectations using PREMAC principle, which is first you do, then we do. Modeling functional communication throughout the day. Presenting choices of preferred activities or tangibles before placing demands or starting DTT sessions. Interspersing easy and difficult tasks to build behavior momentum. Structuring the day by setting up his schedule where preferred activities followed less preferred activities. Using a thickened reinforcement schedule so the client has access to reinforcement quicker, and then we thin this over time. Teaching the client to tolerate periods of inactivity by interspersing them throughout the day and encouraging and rewarding calm waiting. Using visuals and auditory timers to notify when a transition will occur and also to display duration with a preferred activity or tangible. Engaging in functional communication throughout the day, and using visuals to inform the client when he can and cannot engage in self-talk. Behavioral techniques that will be used when the client engages in target behaviors for reduction are prompting functional communication using most to least verbal prompts. When the client uses functional communication in the absence of challenging behaviors, implementing behavior momentum by having him comply with 2 to 3 easy known tasks. When he complies in the absence of challenging behaviors, he can have access to the toy or activity for 1 minute if no demands are in place. If there is a demand in place, telling the client that he can have access to the item after he mans in the absence of challenging behaviors. When the client mans for a break, he can have a 1-minute break. No access to preferred items or activities during the break. Return to the original demand after the break and only allow 1 break per demand. When the client mans termination in the absence of challenging behaviors, he can clean up and be all done with demand. When client demands for a movement break, allow him to jump around for 1 minute. When the minute is over, return to the original demand. Consequence strategies that will be implemented when the client engages in target behaviors for reduction will be that the client will gain access to reinforcement using a 15 token board on the FR2 schedule for independent responses in the absence of challenging behaviors. Once he earns all of his tokens, he can have access to an item or activity for 7 minutes. He can ask for more time once the timer goes off on a VR5 schedule. Providing verbal praise for correct responses during DTT. Praise can also be paired with physical praise, such as high fives, squeezes, fist bumps, tickles, things like that. Tokens can be earned for sitting or transitioning in the absence of scripting, sitting appropriately, and or maintaining appropriate behavior throughout the day. Response costs will be implemented, so the client will lose tokens on an FR1 schedule for every instance of screaming, with or without words, at any point of the session, and scripting while transitioning or at the DDT table. Functional relevance and evidence-based practice. Functional communication training is functionally relevant when addressing the targeted behaviors for reduction, as the target behaviors shown by the client are maintained by access to tangibles, escape from demands or aversive environments, and sensory automatic function. Functional communication has been appropriate for a variety of problem behaviors maintained by social, positive or negative, sources of reinforcement. Functional communication training meets the evidence-based practice criteria with 5 single-subject design studies, which demonstrate its effectiveness for promoting appropriate behavior and communication skills for children at the preschool and elementary school levels. Functional communication training is used to decrease the occurrences of interfering behaviors and to replace clear communicative forms with clearer communication. The integration with the BACB task list. The behaviors targeted for reduction, intervention strategies, and evaluation criteria are linked to the following BACB task list items. G1, using positive and negative reinforcement procedures to strengthen behavior. G2, using interventions based on motivating operations and discriminative stimuli. G4, using stimulus and response prompts and fading. G9, use discrete trial, free operant, and naturalistic teaching arrangements. G11, use Skinner's analysis to teach verbal behavior. G13, use the high probability instructional sequence. G14, use reinforcement procedures to weaken behavior. G15, use instinction. G16, use positive and negative punishment. G17, use token economies. G20, use self-management strategies. G21, use procedures to promote stimulus and response generalization. G22, use procedures to promote maintenance. Thank you. This was Case Study 2. Thank you guys for listening.